In this morning's Health Watch, new guidelines on giving birth. Nearly a third of all births in the U.S. are by C-section, and that's a staggering 53% increase since 1996. It's at an all-time high. But now there's a leading group of OBGYNs which says that number both can and should be reduced. This is important news, not just for pregnant women, but also for dads and for partners out there. Our own OBGYN, Dr. Jennifer Ashton, here to explain. This is your specialty, so this is really right in your wheelhouse. What are the new guidelines? What stood out to me is this could be good not just for women who have had one C-section, but even two.
Exactly, Erica. And this is, in fact, front page news. These new guidelines expand the pool of women who should be counseled and considered for what's called a trial of labor. And when you're talking about a third of women delivering via C-section, we're talking about over 1 million women and their families who are impacted on this news. So basically, these new guidelines include those women who should be considered for a trial of labor, which is, in fact, most women with previous C-sections, including those with 2 previous C-sections, those carrying twins. In the past, we didn't really consider that entity as a possible candidate. And most interestingly for me, a woman with an unknown scar on her uterus. Now, most women will say, well, I have a bikini cut. That's the scar you have on your skin.
Right.
Inside on the uterus, the scar can be up and down. It could be sideways. And in the past, if we didn't know what type of scar was on a woman's uterus, that woman was not considered a candidate for a VBAC. Now, she's in the pool.
Now she's in the pool. So what are some of the benefits to, in fact, having a quote-unquote natural childbirth after a C-section?
Well, listen, there are a lot of them, and we always need to consider risks versus benefits. When you talk about the benefits of a successful trial of labor or VBAC, what we're talking here is obviously the possibility of avoiding major surgery. A C-section is a major operation, and obviously that can be avoided. Lower rates of blood loss, hemorrhage, infection. You lose about 1 liter of blood in an average C-section,
wow.
So this is significant. Obviously, shorter, quicker recovery for the mom, and really improved impacts on future maternal health. Women who want to have a lot of babies, really, they want to minimize the number of C-sections. So this is very significant.
And there's often talk, too, that there can be a real benefit to the baby just from coming through the birth canal. There's a reason it's set up that way if it can work.
Exactly. A C-section is not completely risk-free for the baby. Most moms think they're taking the risk on themselves, and most moms are ready and able to do that, but it's not zero risk for the baby.
And we should point out, too, the VBAC is never going to be zero risk either.
Right.
There are some major concerns. So what are some of the things we need to weigh?
Well, listen, the good news is about 60 to 80% of women can successfully VBAC. However, there are real risks, and the biggest risk that we talk about with an unsuccessful trial of labor, Erica, is what's called a uterine rupture. Mm-hmm. It's a low risk. It doesn't happen often. It happens about 1 in 100 to 1 in 200 cases. But if it happens, make no mistake about it, it can be catastrophic for the mother and the baby with hemorrhage, blood loss, hysterectomy, worst case scenario, a dead baby. It's not something to be taken lightly.
Not to be taken lightly. So if you're going in there and you want to discuss this with your doctor, that you may be a candidate for VBAC, what are the questions that you ask?
Well, first of all, you want to say, do you think I'm a good candidate? Then you want to really do some due diligence about the hospital in which you plan to deliver, because a lot of these issues are liability issues. So you want to ask, is there 24-hour anesthesia? Is there the ability to do a stat or emergency C-section? You need an operating room available. And you want to ask about the pediatrics or neonatal ICU facilities at that hospital. Get all your ducks in a row and hope for the best, plan for the worst.
All right, which was always your advice to all of us pregnant ladies here at the Early Show, and it worked well.
Good.
Jen, great to have you with us, and again, so good,
bet,
especially
Erica.
on this topic, because I know you know it so well.